On this episode of the Ask Mike Reinold Show, we talk about oblique injuries in baseball players.
The Ask Mike Reinold Show. Helping people feel better, move better, and perform better.
Before we get to the podcast, I wanted to make sure you knew about my free online course on the Introduction to Performance Therapy and Training. If you want to learn how to get started optimizing and enhancing performance, this is the course for you. Head to mikereinold.com/performance to sign up today.
Welcome back, everybody, to the latest episode of the Ask Mike Reinold Show. We are here, Champion PT Performance, answering your questions. Anything you want to talk about, head to mikereinold.com, click on that podcast link and ask away. Sports PT, career advice, anything you want to talk about, just ask away, and we'll be sure to answer them on a future episode. Let's see, this week we have Dave Tilley, Dewesh Podell, Lenny Macrina, and Anthony Vedetto here for you. I think we got a good question today, but Len, who do we have for students today briefly?
We have amazing students that I just have grown so close to over the past few weeks that they've been with us. Reading the question today is Ben Fujois from Creighton University. He is a student from Creighton. We have Gavin Harden. This is the last episode with Gavin, so say goodbye to Gavin from Wisconsin University. We have Jacob Kissman from UNLV. And Alpha, Hannah Vignair from Franciscan Missionaries of Our Lady University. Amazing.
Still, it's a long.
It's a long name. Fran you. Fran you.
It's a crazy, but all right. What do we got today, Ben? What's our question for today?
Question from Samantha from Florida, who asks, I have recently started working with more baseball players this winter and have seen a couple of oblique strains. This is something I hadn't seen much of before. I have been slowly getting them back to hitting, but I'm not sure how fast to progress.
Nice. Great. Good job. I like it. Samantha, you know what? This is interesting. And I like how you actually said, I like the statement here. Something I haven't seen much of before. Dave, do you have any oblique strains in gymnastics?
Ish. They're more like thoraco, like rib stuff in the back. They're not so much straight obliques in the sides. Gymnasts do more oblique exercises than everyone. No.
So no.
No.
Okay, good. So oblique injuries are super rotational baseball, right? And even like if you look at like tennis players and even golfers and stuff like that, obliques are a fairly common baseball injury nowadays that's going up that we don't see in a ton of other sports. So if you don't see a lot of like baseball players, it's hard to get oblique strains, a true oblique strain from rotating. So I thought that was like pretty interesting here. She said, I've been slow getting them back to hitting because I'm not sure how fast to progress. So I think that's one thing I can certainly hit on that too. And like some of our criteria that we do with that. But, for an injury that's specific to like a high intense rotational movement, like hitting a baseball, why don't we talk a little bit about that? I mean, who wants to jump in? Anthony, you want to talk about like even just your thoughts on, maybe why we're having this, what you do with them, what you like to progress on their rehab? You want to start?
Yeah, sure. I think with any type of injury, we always come back to what's their workload look like. And I think I've seen this a lot in, honestly, some more like high school athletes than maybe college or professional. Maybe that's just the population that I work with more with. But I think, my main question is, well, what does your hitting look like? What's it been the past couple weeks or months? And they're like, well, I take 100 swings Tuesday and then 300 on Wednesday. And it's like, oh, well, that's where it's probably stemming from, right? So I think it comes down to education. And I think for rotational athletes, they do a lot of rotating in one direction. So I think trying to program some exercise for them where they're doing some maybe anti-rotation things once they can handle that, after maybe some soft tissue and core work. And then having them rotate in both directions so that we're working on more symmetry and we're not just, fully loading one side of their body. I think that's super beneficial for them. And then, once they feel like they can handle this rotation stuff well and they're pain-free on the table, it's, going through a hitting progression, which funny enough, we've been working on that at Champion the past couple of days. So, working on some med ball work, building some tolerance and capacity there, and then, slowly progressing them from a tee to some front toss, and then, building volume and capacity there, and then working on BP and eventually getting back to a machine in, 4 to 6 to 8 weeks there. So, I think it stems from too much workload and then but then really making sure we're working on rotation in both ways, along with some anti-rotational stuff there too.
Yeah, and to Anthony's point, the workload in kids nowadays is enormous. We've never seen it, but I think what we're finding now with hitting, which is very similar to the pitchers, is that everybody is working on max intent swings all freaking year now, right? And that's what it comes down to. It's not just that they're hitting, but it's a maximum intent. It's like, I want to get my exit velo up. I want to get my launch angle perfected. Like, this isn't just like hitting just to like get the body ready anymore. So now we have high volume and high volume of max intent reps like we've never seen in the sport before. In all honesty, we've never seen people train like this. So, that's a huge part of it, Anthony, is that, like, to Anthony's point with the volume and their workload of what they're doing. It's crazy. Len, any tidbits from your perspective before we maybe
No,
talk
I'd
to
just be
Wes
curious.
about it?
I mean, is there a side that you commonly see? For a righty batter, you seeing left oblique? Like, what's your impression? Like, what are you commonly seeing in a hitter and a
Contralateral.
pitcher?
It's
Contralateral, right?
contralateral. Yeah. So it
Yeah,
could be both, but it's usually contralateral. Yeah.
on a hitter and a pitcher.
Yes, Oh, no, no,
Yeah,
excuse me. No, ipsilateral. Ipsilateral. They're pulling over on that side. Yeah, you know what? I'm going to take that back. It's probably like 60-40 for where those are. We actually have those numbers. Let me pull up those numbers while you're talking. I have
I
those
was curious
exact
if there was a
numbers for you.
pattern that I don't know. I thought it was ipsilateral, but I just wanted to, just for the viewers and myself. I don't see a lot of oblique strains. It's just where
Yeah.
my practice has gone to, and so it was just my curiosity to
I
kind
get
of get a conversation going about it, because I think that's a thing to consider as well with kids that are hitting, because it's either going to be an oblique strain or they're going to get some kind of spondy. Is what we typically see in these kids,
I
is
get
a low back.
All right, so here's
You
the
know,
latest numbers. This just came out. That's
yeah,
why I was going to say I just have these numbers. 71% lead side in hitters and 84%, So again, the reason why I don't want to see you trick me. It's the contralateral versus ipsilateral, and it's like which one with like your throwing arm. It's lead
right.
side. I want you to think lead
Gotcha.
side,
Yeah. Okay. Yeah.
like no, nomenclature wise. And then if you
Yeah.
really break it down, it becomes lead side internal obliques, right? And
Right.
trail side external obliques. And if you want to talk about like EMG activity of everything,
Yep.
so that's where it like comes down to. So lead side, like, so again, like if you're hitting, it's left. If you're throwing, it's left. If you're right-handed on both sides.
Yep.
So I guess that's
Yep.
contralateral.
I guess. Yeah. I like the way you put it though. Lead side, kind of like golf.
I guess if
Trail
you're
side, lead side.
right-handed, it's funny. I mean, that's why we just say lead side versus trail side, but that's kind of funny.
Yeah.
I'm still
Yeah.
confusing myself on that, but yeah. So I mean, yeah, that's what we see, right? And you see it all the
Right.
time with these guys just like doing too much. Lenny, I'm sorry, did I interrupt with that stuff? Did you have more on that? I apologize.
No, that's what I think. I think it's pretty neat that when those stats are out there, so for strength coaches and PTs and anybody else that are out there, athletic trainers, like you can build that into their programs. Kids that are ramping up their hitting,
Right.
and I imagine Dewey has talked about it, and we'll talk about it. Like what can we do to work on preventive stuff and help with that explosiveness, because we know it's going to be potentially an issue down the road, and there are patterns to
Right.
this.
And it's crazy. Every injury in baseball, right? So I'm like, I'm working on building out this big baseball rehab course. I have a graph on pretty much every injury that shows injury rates are rising, right? Like with
Weird.
every injury, like every type it is,
Yeah.
it's like amazing.
Yeah.
They all just go up year to year. It's crazy. But Dewey, from your perspective, in the gym, I know when obliques first started, it was kind of funny. Like people were looking to like the blame game was like kind of big, and like, strength coaches tend to get blamed for stuff in baseball, like, unfortunately, right? But they're just like people are like, well, they're doing, at first it was like they're not doing enough core work. Right? These guys aren't doing enough core work. And then they're like, these guys are doing way too much core work. Right? Like and it literally happened within like a 2-year period. Like all the doctors and stuff started saying this at meetings and stuff. You're just like, oh my gosh, like where are we going with this? And then they're like, well, they're not doing the right core work. They're not doing like the right type of it. Like literally had that happen. And then again, I'm sitting there, I'm like, we're swinging too much. Like there's nothing else. It's just like throwing. It's like there is nothing else. We're swinging too much. We're swinging way too hard. It is what it is. But all right, so dude, you got a kid coming back from an oblique, and maybe even have a kid that has a history of oblique, which might be an interesting one for you. What do you do different in the gym with him?
Yeah, I think it comes down to having a very well-rounded way of kind of preparing. Like you said, like the stress is going to be there no matter how you cut it. So you got to make the the torso as robust as possible, right? So Anthony mentioned, all right, let's make sure we have a good volume, anti-rotation stuff, maybe lateral side bending stuff. But I would say that you probably need to do some work moving in that direction too. Because I think one thing that happens with baseball over and over again is it's high velocity rotation, right? So all the body's primed to do is high velocity rotation, but they don't have a good base of slow rotation, right? And I think that's one of the buckets that's usually missing is we either do completely anti-rotation and anti-lateral bending, or we do just bending and just rotation at high speeds. There's nothing that's happening kind of in that like mid ground. So I like covering that entire spectrum of isometric to slow and heavy to fast and aggressive. So cover all that. I think the other bucket is making sure that we're understanding what kind of an athlete we're working with, meaning are they extremely mobile just at a baseline, right? Their spine just moves a ton. There's just a lot more potential for end range movement where the obliques are completely stretched out. And we know that the obliques are not going to be strong and resilient in a very like eccentrically lengthened position. So making sure that we have an awareness of what total rotation looks like and total mobility looks like, and making sure that we give them strength, ownership, and stability within that entire range. And then I think the other thing, it does go back to what you said of just like, it's just too much volume at too high of intensity. So some of it ends up being education. And I've definitely had these talks too, of like, I don't know if this is like stepping outside of my lane, but I think like if I'm there to try to help the kid, like, I think it's okay to mention like, hey dude, like, I think you're just taking too many swings. Yeah. You know, and like maybe it's a little
Dwesh doesn't get it. He's so old school. That's what they'll say.
And they probably will think that. But at least if I can control it, at least in like the timing sense, because kids will come up and ask me this, because some kids hit here at our facility and stuff like this. Like sometimes they'll want to come in and hit for an entire hour and then go do our entire strength program after that, and then probably go hit some more afterwards.
Yeah.
So at least at that point, I can try to control the narrative a little bit, and talk a little bit about how do we spread out the volume of rotations at least. So yeah, I start with just making it as most robust as possible, keeping in mind mobility and stability, and then workload.
That sounds like Lenny and I at the driving range. Honestly, that's that's the same approach for us. But I'll give a couple of tidbits, just because working within baseball, I think you see this more than outside of baseball. So I probably have a couple of gems that most people don't get. There's, in terms of criteria to progress, it's not always pain free. There's actually two phases for me. The first phase, to progress out of that, you have to be pain free with, this is very scientific, the cough test, right? If you cough and you have pain, we're not really getting out of that early phase 1 facilitating healing. But once that cough test goes away in the first few days, maybe a week, and you start to feel better and you don't feel it with coughing, we actually allow some discomfort in the oblique as they go through their progression, both in the gym and with a hitting progression. You don't have to wait till it's 0 out of 10 for them to start a progression. I think that's one thing that people don't understand a little bit. So I think, to me, that's very important. The other thing we do, and I think this is, again, unique to inside baseball sometimes, and this is, my colleague, one of our past students, Brooks Klein, did a really good job getting some data with this. We do an anti-rotation press. We do it on the Kaiser because you can increase the poundage by like a pound at a time, and we'll slowly go up on each side, right? So left and right with an anti-rotation press until they get to a point where they can't do it with discomfort, and that's their number. So say like 54 pounds, whatever it may be, right? Like that sort of thing. And then we compare that side to side, and that's how we give a quantitative number on their oblique. So anti-rotation press, start at a certain poundage, slowly go up, hold that for 5 seconds, see how it goes. And you'll get to a point where you can't do it. And we're looking for that symmetry side to side with that. So they may have some discomfort, but if they can do that, we'll start a slow progression. So the key is, it's okay to go through maybe like a 2 out of 10 pain, but each step, even what like Dewey just said, each step, like you might have 2 out of 10 on the current step, but the step we did last week should now be 0 out of 10. You're starting to get used to it over time. Okay. So a couple of just tidbits on obliques, because again, if you don't see that and you don't work a lot like internal baseball, these don't often go to a PT clinic and they're shut down. Sometimes kids just like rest a week on their own and then ease back in and they're okay. But if you really want to go through it well, those are a couple of tidbits on how we know how to progress and when to progress. Okay. So great question. If you have stuff like that, head to mikereinold.com, click on that podcast link, and you can ask away. And be sure to subscribe so you get notifications. See you on the next episode.